Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Tarafder Shahniam Ahmed, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Dear students, hope you are all fine by the grace of Allah. In our previous episode, we have finished discussing about drugs acting on the sympathetic nervous system. Today we will start discussing about the drugs acting on parasympathetic nervous system, or also known as cholinergic nervous system. The objectives of this lecture is, after finishing this lecture, you will be able to understand the physiology of cholinergic neurotransmission, classify the cholinesterase, identify the drugs affecting cholinergic transmission and cholinesterase, interpret the effects of the stimulation of cholinergic receptors. You will be also able to find out the role of cholinergic drugs compared to other drugs in management of glaucoma, and finally you should be able to know the manifestation and management of organophosphorus compound poisoning. Let us start. In our previous lectures, we have already discussed about the definition and distribution of cholinergic nerve endings. Let us recapitulate some of those terms. Parasympathomimetic means drugs that mimic the actions of stimulation of cholinergic nerves. They are also known as cholinergic drugs, cholinomimetics or cholinomimetic drugs, or cholinesterase, cholinergic receptor agonists or activators. Let us recapitulate the distribution of acetylcholine secreting nerve endings. All preganglionic sympathetic and parasympathetic nerve terminals, parasympathetic postganglionic nerve terminals, somatic neuromuscular junction, secretory cells of smooth muscles of the enteric nervous system, and some postganglionic fibers of the sympathetic nerves such as sweat glands. Now let us describe the biosynthesis and metabolism of acetylcholine. Acetylcholine is synthesized by the combination of acetyl-CoA plus choline with the help of the enzyme choline acetyltransferase, and it is degraded or metabolized by acetylcholine esterase enzyme by hydrolysis into choline plus acetic acid, which is also known as acetate. What are the fates of acetylcholine? Similar to adrenaline, there are few fates of acetylcholine also, but if you remember that the adrenaline is mainly reuptaken to the presynaptic neuron, and acetylcholine in comparison is actually metabolized mainly by the enzyme acetylcholine esterase. Acetylcholine esterase is found in the synaptic cleft and is of two types: true acetylcholinesterase and pseudo acetylcholinesterase. True acetylcholinesterase is found in the synaptic cleft as well as red blood cells. Pseudo cholinesterase is found in the neuroglial cells, blood plasma, liver, and many other tissues. Secondly, the remainder of the acetylcholine is reuptaken into the presynaptic neuron and also in the neuroglial cells. The figure is showing the steps of acetylcholine synthesis and all the way down to its final degradation, and the figure is taken from your textbook Lippincott's Illustrated Reviews of Pharmacology. If I say that explain acetylcholine has no clinical utility, what should be a suitable or probable answer? Actually, acetylcholine has no clinical utility because it undergoes rapid hydrolysis by pseudocholinesterase. If it is given orally, then it will be rapidly hydrolyzed by our gastric enzymes. Furthermore, it has a widespread and divergent non-selective pharmacologic effects, and it is used for experimental purpose only, as it is the prototype. You have already known that the receptors of acetylcholine are classified into two types, muscarinic and nicotinic receptors. Muscarinic receptors are further classified into M1, M2, M3, 4 and 5. Muscarinic 1 receptors are mainly found in the central nervous system as well as M4 and 5. M2 is majorly found in the heart and M3 in the smooth muscles as well as glands. The nicotinic receptors are further classified into NM or NN. NM receptors are found in the neuromuscular junction and NN receptors are found in the autonomic ganglia, central nervous system and adrenal medulla. So, the muscarinic receptors work by the IP3-DAG second messenger system. IP3 means inositol trisphosphate and DAG means diacylglycerol. But the nicotinic receptors act by the sodium potassium depolarizing ion channel. So, that is the basic difference between these two types of receptors. Let us now classify the cholinergic drugs. The cholinergic drugs are mainly divided into two groups, directly acting and indirectly acting. Directly acting drugs are chemically two types or structurally two types, alkaloids and esters. Pilocarpine, muscarine and nicotine, these drugs comprise the alkaloid group, whereas acetylcholine, methacholine, carbachol and bethanicol comprises the esters group. The indirectly acting drugs actually are cholinesterase enzyme inhibitors. They are subclassed into reversible and irreversible type. Edrophonium, physostigmine and neostigmine are reversible, whereas organophosphorus compounds are irreversible. Let us now discuss the uses of esters. As we have already mentioned the drugs, esters are used in case of post-operative paralytic ileus, post-operative or postpartum urinary retention, neurologic bladder and reflux esophagitis. In case of the indirectly acting cholinesterase inhibitor drugs such as edrophonium, it is used in case of diagnosis of myasthenia gravis. Physostigmine may be used in glaucoma, atropine poisoning. Neostigmine is used clinically in treatment of myasthenia gravis and also for reversal of depolarizing muscle blockade. And organophosphorus compounds are worldwide used as insecticides and pesticides in our agriculture. You should be able to learn the differences between physostigmine and neostigmine. Quite naturally, physostigmine is derived from natural source, is a tertiary amine and hence highly lipid soluble. The highly lipid soluble drugs, as you know, can cross the blood-brain barrier and is CNS toxic. Physostigmine, as we mentioned earlier, is used in glaucoma and atropine poisoning. On the other hand, neostigmine is derived from synthetic source. It is a quaternary amine and hence water soluble and cannot cross the blood-brain barrier. It is used in myasthenia gravis, paralytic ileus and also reversal of neuromuscular blockade. So, let us summarize the indication of uses of cholinomimetics or clinical use of cholinomimetics as a whole. That will be diagnosis and treatment of myasthenia gravis, reversal of neuromuscular block or paralysis, retention of urine due to bladder problem, atropine poisoning, xerostomia, that is dryness of mouth, insecticide, pesticide and modern warfare, paralytic ileus, glaucoma and tachycardia. That's all for today's episode. We shall continue our class in our next episode. Thank you all. Assalamu alaikum wa rahmatullahi wa barakatuh.